Hello and welcome to Sofa Health Talks. I'm your host, Liana Shangalaya. My podcast will cover all the topics about health, beauty, wellness, and arts that is essential to our health and well-being. Today will be joining us Dr. Avneet Sodhi Gaur. She's a board-certified, fellowship-trained cataract, refractive surgeon, and a glaucoma specialist. She's among LA's top doctors 2020. Hi, Dr. Avneet. Welcome to Sofa Health Talks, episode 7. How are you?
I'm doing well. Thank you for asking me.
Okay, let's hop into the topic about eye care and eye makeup hygiene. I have seen some of your posts about it. Makeup products, including mascara and eyeliner, is an important part of many people's beauty regimens. And poor habits is common among many people. It may lead to eyelid inflammation, known as blepharitis, and other eye disorders. So, what are the simple steps that everyone can take in order to prevent that?
Sure. I mean, let's start with what are the bad habits that people do, first of all, and then kind of solutions on avoiding doing those. One of the biggest problems is people sleeping in their makeup. They don't take their mascara off, they don't take their eyeliner off at bedtime, or they think they sufficiently take it off by washing their face only, not using makeup remover wipes. So there's residual makeup left on the eyelid margin, which leads to blepharitis, which is basically eyelid inflammation and an overgrowth of bacteria. You take it lightly, and over time, it actually starts to lead to serious eye infections, so on and so forth. So just simply at night, not just wash your face, but also use eyelid makeup remover wipes that are non-toxic. And that's a whole different subject there, which ones are non-toxic. But essentially, even using makeup eraser wipes are great because it uses no chemicals with it. So that's number one. And number two is people don't replace their makeup every 4 months, their eyelid makeup. So why every 4 months is because the mascara wands or even the eyeliner wands, they start to grow a biofilm of bacteria on there. And so if you keep it for 6 months, a year, then you're reintroducing that bacteria to your eye every so often. And again, it will lead to eyelid infections and irritation to your eyes. So replacing your eyelid makeup every 3 to 4 months is extremely important. Sharing makeup is a big no-no for me. I'm very OCD about that,
Here.
and everybody should be as well. But even if you get somebody to do professional makeup on you, make sure that they clean it very, like, even in front of you, just make sure they clean it, because it's for obvious reasons. Would you ever share your underwear? No. You
No,
wouldn't want to share something close to your eye or anything like that. And same goes with contact lenses. Never share your contact lenses as well. So obviously, that's kind of written on the wall. When you don't share eye makeup in particular. Why, like, eyelid makeup, like eyeliner, mascara? Because the other thing is, not only it leads to blepharitis, it leads to blocked oil glands, which is probably the number one problem globally, that it leads to dry eyes, a blocked oil gland, and it leads to chalazions, or inflamed bumps on your eyelid that people commonly referred to as styes, but they're not interchangeable. So chalazion styes are basically blocked glands. And then, other things are like glitter eyeshadow are big culprits, that they get into the tear film and cause a lot of eye irritations. So kind of stay away from those if you can. And then waterproof mascara, I don't really like, because it's really, really hard to get off.
And it's
And
very heavy on the eye.
very heavy. And even when you try to remove it with eyelid makeup remover wipes, you have to really rub. And the thing is, you're causing the eyelashes to break. And
Yeah,
so over time, you'll notice
it's
that the eye,
irritating.
they're like, oh my gosh, my eyelashes are, I barely have any. And I was like, well, do you use waterproof or not waterproof mascara? And they're like, well, I use waterproof. And I was like, well, that might be the reason why. So those are kind of the biggest things, or bad habits, that we do with our makeup, and things to kind of solutions to change those.
That's a great advice. Not many people are aware about it.
Of
Thank you for sharing.
course.
It's very helpful. Yeah, well, I can't sleep without removing my eye makeup. Can you specifically advise eye makeup remover?
Okay. Well, so think there's a website, and it's actually kind of, I think it's called skinproducts.com.
Okay.
And you can actually go to that website and put in whatever makeup wipes you have and Google what the toxicity of it, or if it's a safe for your eyes or not. Really great ones are like micellar water wipes, which are from like Burt's Bees. They're really great. Neutrogena has great ones. I talked to you about the eraser wipes.
Yeah, yeah.
It's just basically a cloth that you wet, and then you just remove your makeup that way. And that's actually what I use. It's just very gentle to the eyes, and it's really easily comes off.
Mhm.
And then I use also the micellar water wipes that are like from Burt's Bees, which is really great. A lot of these products, they will put in like formaldehyde and parabens and alcohol, just
Yeah.
things that are very irritating to the eye. So if you just even go to that website, it will give you an idea of, is this safe to put around your eyes or not. There's a really great website called eyesarethestory.com. They actually make products for around the eyes, even cosmetic products for around the eyes, like mascara and eyeliner, that is optometrist approved.
Oh,
And
amazing.
yeah, it's a really great website to get even just eyelid remover, makeup wipes, and all that stuff from them as
I'll
well.
definitely check it out. Mhm.
And actually, California is kind of the first state that will ban any toxic ingredients in cosmetic. That just got,
Amazing.
yeah,
So Meisler is the
yeah,
best
just kind of
option.
like as needed.
Perfect.
Yeah.
Great. Okay, let's move to next question. It is known that prolonged exposure to UV rays from sunlight might cause early onset cataracts and eventually blindness. But there's not much of information about the impact of blue light. Can you tell us what kind of effect it has on our eyes?
Sure. So there was, I believe in 2018, there was like an alarmist headline that came out that blue light is dangerous for your eyes. And it was kind of like a warning that everybody, to this day, I still get patients. They ask, is it really true that blue light damages your retina or causes blindness? But fortunately, the answer, what we think right now, is no. The American Academy of Ophthalmology says no, it's not conclusive that blue light damages the retina and causes blindness. Why we put this out is because that study that showed that blue light might cause damage to the retina or to your eyes, they actually took cells from cervical cancer cells. So it wasn't even eye cells. They put them in a petri dish. They emitted it to extremely high doses of blue light and obviously showed damage to the DNA. But obviously, in our eyes, they didn't do eye cells, they didn't do to what we are exposed naturally to blue light. So it wasn't, you can't make, it's apples to oranges. You can't
Mhm.
make a conclusion from that study. Blue light we naturally get from the sun,
Yeah,
it just, it comes from the sun. It offers, it's a good thing, but obviously you want to get it in small doses. When the sun is highest, we get the most blue light, and it tells us, okay, stay awake. When the sun sets,
yeah,
there's less blue light emitted, and then our melatonin levels start to increase and tells our bodies to go to sleep, right?
yeah.
Now with the introduction of digital devices and cell phones and all that stuff, we're being exposed to more blue light. Blue light does lead to is a disruption to our circadian rhythm.
Exactly.
And then the other thing that it leads to something called digital eye strain. And it's not really blue light that's causing that. It's because we're just excessively looking at our phone and not blinking enough.
Mhm.
And what digital eye strain is dry eyes or sensitivity to light or occasional blurriness, headaches. Those are all kind of a blanket form of digital eye strain. And so basically the rules that we have is there's kind of this golden 20-20-20 rule with your cell phone or computer or watching TV. every 20 minutes, look 20 feet away and blink 20 times, so on and so forth. So for like 20 seconds. So that's kind of a simple rule, lubricating your eyes and then putting your device away about 2 hours prior to bedtime, which we are all terrible at, especially myself, but
Yeah, that's
trying
quite
to do that,
challenging.
it's quite challenging. And, but if you try to mentally just do that, or at least get better, especially when you're starting to get those symptoms, then doing that a little bit more will allow you to get less of that digital eye strain symptoms.
Yeah, well, some say an hour at least.
Or before, but that's still hard for
Yeah, it's
people.
still hard. It's,
It's still hard.
yeah, great. I'm actually wearing a blue light filtering glasses.
Yeah, yeah.
Brand I'm launching soon.
Right.
But yeah, I do feel better. Maybe it's a placebo effect, or I don't know what to call it.
I mean, yeah, when patients ask me, what do you think about blue light? I give them, my explanation to them, and they said, well, I feel better when I do have, and even my colleagues, my ophthalmology
Yeah,
colleagues, and I tell them, I don't condone you getting blue light, filtering glasses, that's fine. I just want you to know what, obviously maybe it's helping with the headaches and digital eye
yeah,
strain that you're experiencing. And, if it helps, go ahead and do it. I'm not saying not to do it,
yeah, yeah.
but understanding, or just getting the fear out that blue light is damaging to the eyes is kind of the point, just to be driven.
That's good to know. And also, it's important to reduce the screen time.
Yeah.
Yeah,
For a
that's
lot of
number
a
one
lot of
rule.
reasons. Yes, yes.
Yeah, about the twitching of the eye. I used to have twitching, but after wearing this, it's gone.
Hmm.
So
Okay.
it's quite common twitching. Some people think it's a serious problem. And can you explain what are the causes of twitching?
Sure. So eyelid twitching, first of all, if it's just localized just to the eyelid and it's a very small tick or twitch that nobody else recognizes, but you just feel. So some of the common causes are lack of sleep, dry eyes, or eye allergies is a really big two of those. Too much caffeine is another big thing as well. And some of them, I had a patient recently who had an eyelid twitch, and they said, well, I get good sleep. I don't have dry eyes. I don't have any eye allergies. My caffeine intake hasn't changed. I still drink a cup of coffee a day. So I don't know why I'm getting these. And I said, well, the cup of coffee, what do you have for a cup of coffee? Well, I have just black coffee, but then recently I just switched to, I think they were doing like a double espresso, but it was still a cup of coffee. So I said, well, the caffeine intake has changed, even though you're still drinking the same cup. So obviously it's just kind of giving, just looking really closely at if there's any lifestyle changes, anything like that. Is really easy fix. I've been actually getting quite a bit of eyelid twitches because the air quality in California hasn't been so great because of the forest fires that we've been having. And so it just precipitates a lot of dry eyes and irritation to me. So I just been lubricating, and it helps quite a bit.
Mm-hmm. They say also magnesium depletion could also cause.
Potentially, not really conclusive.
Not
So
very,
yeah, I mean, yeah,
not much of
magnesium,
evidence right there.
not as much evidence with that. So.
Okay, great. We're aware that age-related macular degeneration is the most common cause of the blindness. How can we improve our visual health as we age?
Some healthy choices that we can make as individuals. Number one, exercise daily. That helps to decrease glaucoma. There's some studies that have shown that a healthier lifestyle helps to prevent the progression of glaucoma if you have the diagnosis of that. Also prevents diabetes as well, or controls your diabetes if you do have them. So
Mhm.
obviously those two can lead to eye symptoms if they are not controlled. Exercise also just overall is good for your health, right? So that number one. Number two, a healthy diet. So a healthy diet rich in antioxidants such as lutein, zeaxanthin are extremely great for eye health as well. UV protection, as we kind of touched a little bit based upon, you said that with cataracts, you can get a progressive cataract if you have more UV exposure. Protection with from UV with sunglasses that have UV protection on there. So with sunglasses, people get confused that the darker the sunglasses, they think they get more UV protection. That is not true. You actually have to make sure that the glasses say either UV 400 or UV 100% to actually have UV protection.
Mm-hmm.
And UV protection does not equal the same thing as polarized sunglasses. That's two separate entities too. So just, want to make sure that sunglasses have UV protection. And then, obviously avoiding too much outdoor like UV light. If you're going to the beach quite a bit, just obviously wear your sunglasses, or not even has to be the beach, just outdoors. Because UV exposure not only leads to cataracts, it can lead to skin cancers on the eye, skin cancers inside the eye. There's a multitude of other issues, even something called a pterygium, which is just an overgrowth of the white part of the eye. Just doesn't look great when people see it, and then can be very irritating. So it just kind of prevents those from occurring. Smoking is a really big risk factor for a lot of different eye diseases, such as macular degeneration, as you mentioned. So avoiding smoking is extremely big, especially it can worsen if you have thyroid eye disease. It can worsen the thyroid eye disease. So smoking, since stopping smoking is really critical for improvement of your eye health. And then I touched a base upon the 20-20-20 rule, which is really important in our digital age. So it just will prevent dry eyes that will occur in the future. A lot of people say, well, I don't have dry eyes, but if you actually go to your ophthalmologist or optometrist and get an exam, I would bet that there is some early signs of dry eyes, just with the amount of technology we use these days. And then just scheduling your eye visits, making sure you're on your regimen for scheduled eye visits. If you're a contact lens wearer, you should have a yearly eye visit. If you're not contact lens wearer, then in your 20s, you should at least have 2 visits. In your 20s, in your 30s, at least 2 or 3 visits. And then by the age 40, yearly visits thereafter, because a lot of eye diseases start to show. So just being good about going to your eye doctor and getting those kind of basic checks, just as you go to the dentist, right? So, but we have only 2 eyes, not 32 teeth, right? So you only want to make sure you have your 2 eyes preserved. So going to your eye doctor is really important.
Yeah, there's not much of awareness spread around this topic, and that's great information. It said about specific nutrients that would help to ward off visual problems. Is there a specific diet you would recommend?
Um,
Vegetarian diet, for instance, or
well, the Mediterranean diet is typically highest in lutein and zeaxanthin, and it just provides rich antioxidants to your eye, so it helps to prevent or lessen the chances of getting, for example, macular degeneration.
Mhm.
Um, and so I get a big question on, are these eye vitamins called AREDs or Ocuvite something that I should take daily? Not necessarily, unless you have a diagnosis of macular degeneration. And even with that, people with macular degeneration early type, it's not really proven to help with that as well. So really in the studies, it only showed moderate macular degeneration, that it helped to decrease the progression of it about 25% over 5 years. So, and a really great antioxidant is called, I believe it's called astaxanthin, which it's not really prevalent in a lot of foods. Astaxanthin was actually an antioxidant, and zeaxanthin and lutein are derived from these, and so it basically helps to. It basically was derived from an actual algae, and it was high in antioxidants. And fish that actually eat this kind of algae are is like sockeye salmon or krill shrimp. And how you can detect where these foods are is because these like salmon and krillfish, they're pink in color, because astaxanthin is actually pink in color. So it's a very powerful antioxidant that you can get from foods as well.
That's very helpful. And the last question for parents. How can a parent detect if a child has a lazy eye, amblyopia? It's important to diagnose early in order to prevent further visual problems in childhood.
First and foremost, parents should be taking their kids to the eye doctor, not just to the pediatrician, but to an actual ophthalmologist or optometrist, because a vision screening can actually miss amblyopia. They could be reading the line, but it could be distorted, or it could, they could pass a vision screening, but they can fail an eye exam.
Mhm.
So really important to go to their scheduled visits with an ophthalmologist or optometrist. And what that is 6 months of age, they should go visit. About 2 to 3 years of age, around when they're going to start kindergarten,
Mhm.
and 5 years of age, essentially, when they're about to start kindergarten. So that's kind of the schedule that they should, and it should pick up majority of lazy eye, or aka amblyopia. Other things are if you notice your child squinting, or if they have to sit up close to the board in class. I mean, right now it's all virtual learning, but if they see them, they're squinting, there might be an issue with their eye, that they should get an eye appointment. Other things, that if parents see a white reflex instead of a red reflex, that could be a serious eye disease, or it could be not serious, but still always important just to get the eyes checked to make sure everything is okay.
Actually, not many parents are aware about it, that it's also important to take their children to ophthalmologist. So regular
Correct.
checkup, as you said, from starting from 6 months, and then two
6 months
years
of
age,
age.
and then five.
Yes.
It's the
Yes.
best.
Yes.
And because the prevention is the key, right?
Prevention is key. Yes, prevention is extremely important. It means a lifelong good eye health for your child.
Exactly. Okay. If it's not a secret, do you have any celebrities coming to regular checkup, eye checkup?
I do have quite a celebrities that I do see. Unfortunately, because of HIPAA, I can't reveal some
You
of them.
can't feel. Yeah, I know.
But yeah, I mean, the ones that have said it was okay that we do say that we have treated, like LeBron James, and
Mhm.
is a prominent one that comes, and Anthony Davis, who comes. Yeah, so a lot of the NBA players, we've treated, as well as other celebrities. I think Rufus Swirl, he's doing a movie with Tom Hanks. He's one of my patients who I've posted on my Instagram, who said it was okay to post. But
Mhm.
other celebrities, I can't disclose. But
Yeah.
they're all our patients are celebrities to us. So.
Yeah, exactly. Yeah, that's a good approach.
Of course.
Great. Thank you for answering all my questions. It was very informative and very helpful. And it's a great takeaway for my listeners. How they can get in touch with you.
They can visit our website, assili.com, ASSILEYE.com. All our physicians, it's mainly me and Dr. Carrie Assil, who started the Institute. And so you can contact through our website. Our phone number is on there as well. I'm available on Instagram,
Mhm.
at Avneet Sodhi Gaur, MD. So you can search me on that, as well as we do have a company Instagram handle as well, a CLI, where you can see what procedures we do, what we offer, what surgeries are before and afters of our cosmetic procedures as well. So we offer a lot of information, and a lot of people find us on there.
That's awesome. It was really great chatting with you.
Thank you. I'm glad we were able to finally make this work, and it
Yeah,
recorded and
me too. I'm
saved.
so happy.
Thank
I'm
God.
so happy.